A 20 years old man developed acute appendicitis. His appendix is removed and make full recovery. Which of the following pathological process is least likely to be present in case of acute inflamed tissue? So, a 20 years old patient developed acute appendicitis. He undergone operation, appendix was removed and now fully recovered. But here in the question, they want to know about which is not occur in case of the acute inflammation. Here the options are altered Starling force, sequestration of the neutrophil, formation of the fluid exudate, formation of the granuloma, and none of the above. First of all, let's see the neutrophil polymorphism, or the neutrophil, it is cell for the acute inflammation. On the other hand, in case of the chronic inflammation, there is lymphocyte present, there is macrophage present, and there is the granuloma formation. So in case of the chronic inflammation, keep in mind that in case of the chronic inflammation, always look for macrophage there, always look for lymphocyte here, and always look for granuloma there, macrophage, lymphocyte, and granuloma. And in case of the acute phase, always search for neutrophil. So in case of the acute phase, always search for neutrophil. In case of chronic phase, always search for macrophage, lymphocyte, and granuloma. Let's see the pathophysiology of acute inflammation, or in case of the appendix, it is the acute appendicitis. So first of all, what happens? Let's see. Suppose it is the cecum and appendix located at the base of the cecum. So what happens? Suppose this appendix, it is obstructed by the piccolith or foreign body or any other thing. So what happened? The obstruction of the appendiceal lumen inside the appendix. So what happened? Build up mucus. So here in case of the appendix window, it has the epithelium. So from the epithelium there is continuous secretion, or endothelium continuous secretion. So there the accumulation of the secretion, and appendiceal lumen pressure increases as there is the more fluid. Then what occurs? The ulceration of the appendix mucosal lining. As the mucosa is pressurized, so their vascularity reduce, and finally there is ulceration of the mucosa, and there is also reduce of the oxygen to this area. Also there is blood flow reduce in the appendix. So it promotes the microbe invasion, which usually bacteria, and after bacterial invasion there comes our body defense, which is the neutrophil, because the neutrophil is the first line defense for the acute inflammation. So the inflammation and swelling of the appendix, finally appendicitis. So now, which is not, or less likely, which is not present in case of the acute inflammation? Here we can see alteration of the Starling force. It is also true because there is the edematous, but also there is sequestration of the neutrophil. It is also true because neutrophil is the first line defense for the acute inflammation. Then formation of the fluid exudates. It is also true. Formation of the granuloma. It is feature of the chronic inflammation. And other two important feature of chronic inflammation is the macrophage, and second one is the lymphocyte. So our answer here, it is the formation of the granuloma. The granuloma, it is not a feature of the acute inflammation, because the granuloma is a clinical feature of the chronic inflammation.